Welcome! You and the medical team have decided that a tracheostomy is right for your baby. There are many reasons why a baby might need a tracheostomy. Your child may be experiencing difficulty breathing, tiredness, or poor weight gain. You might also hear your baby make a squeaky breathing noise called stridor. These symptoms might be caused by a narrowing or obstruction in the upper airway, normally caused by subglottic stenosis, tracheomalacia, or other disorders that make it hard to breathe, cough, or clear one's throat. This can be a very stressful time for you, so we are here to guide you through this process and ease any uncertainty you may have. In the simplest terms, a tracheostomy is a procedure in which a small hole is made through the neck and windpipe and a breathing tube, or trach tube, is inserted. The tracheostomy tube bypasses any obstruction in the trachea and brings air to the lungs. It also makes it easier to remove secretions that a baby might have a hard time clearing on their own. Parents are often concerned about pain or any discomfort their baby may experience living with a trach. Parents can rest easy knowing their baby is asleep during surgery and they will not feel any pain or discomfort during or after the tracheostomy. Parents will be able to rest and cuddle their baby on their chest like any other baby. The trach tube will be firmly secured to your baby's neck to eliminate any risk of the baby pulling the tube out. During the tracheostomy procedure, your baby will be asleep and will remain asleep for several days in the Pediatric Intensive Care Unit, or PICU, to allow the airway to heal. We will make sure your baby remains well hydrated with fluids given through an IV and well nourished with formula or breast milk given through a tube inserted through the nose and into the stomach. While your baby is asleep and healing, the nurses and respiratory therapists in the PICU will teach you how to care for your baby's tracheostomy, including suctioning the tracheostomy tube and changing out the tube periodically. We have some educational videos and reading materials to help you. Once it is safe and your baby is awake, our swallowing specialists will work with you and your baby to help them transition back to eating by mouth. You will also begin to practice hands-on care of your baby's tracheostomy tube, which includes the following steps. 1. Wash your hands. Wash your hands thoroughly for 20 seconds. 2. Clean around the stoma hole where the tracheostomy tube enters the throat using a cotton swab or gauze. 3. Dry the skin around the stoma with fresh gauze. 4. Suction the tracheostomy tube for secretions as needed. 5. Change the tracheostomy ties once a day or anytime they happen to get wet. 6. Keep an HME, or heat moisture exchange, on the trach tube to keep it humidified and moist. And 7. You will need to change the tracheostomy tubes every 2 weeks. Once you have learned the proper care and maintenance of the tracheostomy and feel comfortable performing it, your baby will be ready to go home where they can play, gain weight, and develop just as any other infant, breathing comfortably through their trach. Should you have any questions or concerns, please refer to the educational materials provided or call the medical team at any time. As our very own Dr. Hartnick says,
You will be caring for a baby with a trach, not a trach with a baby.